Hello, I'm Dr. Tom Lewis, a medical data scientist with a PhD from MIT and credentials from the Harvard School of Public Health in both toxicology and nutrition in the public interest. I've been speaking to functional docs at forums like the A4M and the IFM on cancer since 2011, with specific emphasis on the root causes of cancer genesis and is cancer an infectious disease, which for the most part I believe it is. We are introducing a new diagnostic program for your cancer risks and your prognosis of a good versus a poor outcome in cancer. The biomarkers that we have assessed are all well studied and published in the National Library of Medicine, PubMed, and titrate or at least are strongly associated to cancer risk and prognosis. Our program is Above Cancer Diagnostics, brought to you through Health Revival Partners. And what we're telling you is that we can provide you with the earliest cancer detection, or even better than that, your risk factors for future cancer or poor outcomes. And we offer life-saving solutions because every marker we test for is modifiable, either through lifestyle interventions or pharmaceutical interventions and other interventions that aren't necessarily used by traditional oncology. Indeed, if you have a tumor, you should be seen by an oncologist to determine whether the tumor itself needs to be treated. But the disease is not the tumor. There's something underlying that causes tumor formation. So here's some above cancer quick facts. Cancer triggers a measurable immune response. That's a Nobel Prize in medicine in 2018. And this led to the use of biologics, really immune suppressants, but they're also inflammation suppressants in cancer therapy. Biomarkers provide early warning and prognosis status. A key example is the neutrophil to lymphocyte ratio, or NLR. When this value is high, your risk and prognosis for cancer are poor. And if you can modify this value, as shown by the Harvard School of Public Health and Harvard Medical School, is you reduce your likelihood of a poor prognosis. Here's the issue in looking at cancer from a physiological or biomarker perspective. Normal values don't reveal chronic or smoldering disease, which is usually the case in cancer. In the standard of care, you're either healthy or sick, nothing in between. Is that possible? We posit that we all live on a cancer continuum, a health continuum, a disease continuum. Standard of health is what we profess is a new scientific-based system that looks at values for biomarkers tied to early mortality risk. When these biomarkers are even slightly up, you're at risk, but we can improve on these markers. This approach places you on the cancer continuum. So what did we do in our cancer algorithm? All biomarkers are readily available, LabCorp and Quest. These are immune system and basic physiological markers. Cancer normal and abnormal biomarker levels are established based on cancer mortality data published in the National Library of Medicine. Since we have a single endpoint, cancer mortality, we can produce a single risk score across multiple biomarkers and provide you with where you are on the cancer, health, and disease continuum. And like I said, all these markers are highly researched from peer-reviewed journals in the National Library of Medicine. All markers are modifiable through lifestyle changes or other interventions. This approach treats you, not the tumor. And it's your terrain, your physiology, that can make you vulnerable to cancer or a poor outcome. If you do have cancer, we clearly recommend you see an oncologist and consider treatment for the tumor. This approach increases your odds of avoiding cancer if you improve your risk score. It improves your outcomes if you have cancer, if you improve your risk score. Here's part of our report. It's a very detailed 43-page report. This is page 1, and this is an actual late-stage cancer patient. Well, we have broken down cancer into 6 different major categories: immune health status, infectious burden, tissue damage biomarkers, inflammation, oxidative stress, and your metabolic status. And we combine all these into a single cancer risk and prognosis score. So here's a list of all the biomarkers. I won't run through all of these, but we can see infection, inflammation, immune response, vascular health, metabolic, clotting factors, neutrophil to lymphocyte ratio, which I referred to earlier. And so we're just looking at the oxidative stress area. And here we see the normal values. And this person had a value for ferritin of 600, which is way out here on the high risk end. Transferrin, another oxidative stress marker. This is where you want to be. This is where this person was at the time of the measurement. Haptoglobin, optimal, not optimal. Once again, all repairable. Myeloperoxidase, way out of whack. You want to be in this range. So you can see that you can very quickly, through our single score, but for the individual scores for each biomarker, see where you are and measure your progress as you effect interventions to improve your risk or outcomes. There's a number of new cancer diagnostic companies that have come forward recently, but we're advancing cancer solutions across the spectrum of disease. These are traditional cancer markers. If one of these markers is up, you most likely have a tumor. And where do you go? Oncology for radiation, surgery, chemotherapy, biologics. But we look across the entire spectrum, and we're looking to modify risk markers that lead to the elevation in these markers. This is a much more proactive approach, and it covers even late-stage cancers. You always have an opportunity to improve your outcome. There are many people with late-stage cancer that survive. Why? The devil's in the detail. The markers tell that story. So the next cancer frontier is earliest risk detection and prevention. Through our program, find out where you are on the cancer risk and prognosis continuum. Start lowering your risk now through lifestyle interventions or other interventions. And you can find this diagnostic available to you today on healthyvitalpartners.com/cancer. Once again, Dr. Tom Lewis, medical data scientist, spent a good part of my career in understanding cancer, and I believe we have the most robust diagnostic and solution protocols for cancer on the planet. Thank you very much.